All right, good morning. Welcome. This is Med120. This is Dr. Garais, Monday morning, and today is the 22nd. Now, this is week 5, and it's a midterm. So by the end, so please get everything that's due for week 5 in a timely manner. Typically by Saturday. And you know me, I say Saturday, but I really touch things like Sunday night at like 1 a.m. But this week I have to post grades by 12 noon Saturday. By 12 noon Saturday for all my classes. So please get everything done. And your midterm grade is just like, it's just to tell you where you're at, okay? But typically, if you go into your Moodle and you look at your grades, every week is 10%. So you should, as of today, have submitted everything in from week 1 through 4, which is medical language laboratory, week 1 through 4, quizzes from week 1 through 4, and discussions week 1 through 4. And even though week 5, module 5 stuff is due next Monday, I implore you to try to try to get as much as in by the end of the week, by Saturday, definitely by 12 noon Saturday, because that's when I have to have grades in. And remember, they're just, let's say you can't get your week 5 stuff done by Saturday, or you typically do your week 5 stuff Sunday. It's okay, but because the midterm is simply like just a reminder of telling you where you're at. And if you're around 40%, you're batting 1,000 right now. You are supposed to be where you're supposed to be. Okay? So with that being said, what's due today? Medical language lab stuff for week 4, quiz from week 4, and discussion from week 4 by closing of business today. And by closing of business, typically 6 p.m. today. Okay, so what is the topic for today is nervous system and endocrine system. Now, these are your 2 major communication systems in your body, and the nervous system is fast. Us pertaining to your nerves, and the endocrine system is crin, means secretion, endo, within. So endocrine system deals with hormones, and hormones are chemical messengers that send signals throughout your body. Like an example, growth hormone is the signal to your body, you should start growing. Another common thing in endocrine is insulin. Insulin is a hormone that signals your cells to open up so it can accept glucose, which is the fuel that your body will process so that you can continue on living. So with that being said, let's jump right into the endocrine. So we're going to go into our ebook. And, okay. I use this book like every other day. I don't understand why it keeps on asking me for cookies, but it does. So I don't want to go to chapter 5. I want to go to endocrine. So the endocrine system and the nervous system, what do you call that? It always starts off as who are the people in your neighborhood. So the 2 departments are endocrinology and neurology. Endocrinology is a subspecialty of the Department of Internal Medicine, and neurology, logi, study of nerves and also your brain, that is their own specialty. So endocrinology, they're very good at hormones, and I mentioned insulin a minute ago. They are the experts at diabetes, because diabetes is an insulin receptor problem, and they're the best at it, and that's endocrinology. And of course, neurology, they deal with the brain and spinal cord. And these 2 departments represent the major messaging systems of your body, how your body knows what's out in the outside world, and then also how does your body respond and do things. So the endocrine system is essentially all the glands which either store or secrete hormones, and hormones are the chemical messengers. And here are some examples of the glands. You have your hypothalamus, your posterior and anterior pituitary, which is all located in the base of your brain. You have your thyroid gland and your parathyroid glands. And you look at the word parathyroid. Para means alongside. So it has to be the glands that are alongside your thyroid gland, which is here in your throat. Your thymus is also located in your chest, and it is very important in your immune system. Adrenal glands, let's look at that word, adrenal. Al, pertaining to, ad, on top of, ren, which are your kidneys. So here are your kidneys. So you have your adrenal glands that are on top of your kidneys. They're also known as your suprarenal glands, or super, on top of, okay? And your gonads, which are your, for female, ovaries, and for male, testes. And the hormone responsible for female secondary sexual characteristics, you know, the things that make you female, of course, are estrogen. And for secondary sexual characteristics for male is, of course, testosterone. Okay, so let's look at some of these. Let's look at some of these endocrine words. We already know what a gland is. It is something that either stores or secretes hormone, the chemical messenger. So adeno is the root. And if I have an adenoma, I have a tumor within my gland. Now, remember, tumor is just a lump or a bump until the biopsy comes back. And if the biopsy comes back that it's cancer, then now I have an adenocarcinoma. Okay, carcin means tumor. I mean, not tumor, means actual cancer. Tumor just means lump or bump to us. Your adrenals, we already went over that. Adrenectomy, remember ectomy, ek. What do? I excise it. What do we do with our X's? We cut them out. And that's what an excision is. That's what an ectomy is. Calcium. Now, hormones also control the level of different minerals in our bodies. And one of those minerals, of course, is calcium. And remember, too much calcium is a bad thing. Hypercalcemia, bad. And too little of a good thing is also bad. Hypocalcemia. We should be normocalcemia, or another term for that, and I believe we went over this in the cardiovascular section, is the prefix U. So if my patient has eucalcemia, it's the same thing as saying it is normal. Normal calcemia. Emia, blood condition, norm of calcium. And even if we look at the word normal, it means al, pertaining to the rule. And the rule is we should be where? Somewhere in the middle. Not too much calcium, not too little calcium. We should be in the middle. And if I am abnormal, or I have abnormal results, remember how we read our medical terms? We start for the suffix and then go to the beginning and work our way back. So it means pertaining to. We already know that. And ab means away from the rule. So if I'm going away from the middle or away from norm, that means either I'm too much or too little, I will have abnormal results. Okay? And we could expand this eucalcemia to tachycardia, too fast, right? Bradycardia, too slow, your heart, eucardic patient, normal heart rate, normal cardiac, normal heart rate. And for those of you at home watching, that's typically 60 to 100 beats per minute. Okay, so you look at these terms, Remember, you can always build and add on to what you already know. Sugar, glucogenesis. Genesis is a state or condition of creation. Gluco is sugar. So glucogenesis is the creation of sugar, or glycogenesis, the creation of sugar. But remember, if I have too much sugar, that's not a good thing. Hyperglycemia. If I have too little sugar, that's not a good thing. That's hypoglycemia, just like this. So hyperglycemia, emia, blood condition of too much sugar. Diabetics can have that. You can go into a coma, and it's a bad thing. But diabetics also have this too. If they take too much of their insulin or too much of their meds and they don't eat enough or they're not eating right, that's blood condition of too little sugar. You can also go into a coma there. Where do we want my patient to be? I want my patient to be euglycemic. I want my patient to be normal glycemic. Okay. So you can see how building the words from our previous chapters and combining them can get us new words, and that's that thing that we talked about week 1, week 2 is programmed learning. So glucogenesis, hyperglycemia, pancreas, pancreatitis. Your pancreas is located in your left upper quadrant, right behind your stomach, right like behind and underneath it. And the big things that pancreas secretes is insulin. And we now know that insulin helps get us the sugar, helps the sugar go inside our cells. But if I have pancreatitis, itis, inflammation, or my pancreas, can my pancreas do that job anymore? Nope, because we recall itis was the 5 cardinal signs and symptoms, right? Tumor, heat, pain, and the number one thing out of the itis is loss of function. So you have pancreatitis, it's a very, very serious thing, and it's life-threatening. Parathyroid, parathyroidectomy, I could remove it. I could remove it due to parathyroid carcinoma. I could remove it due to parathyroiditis. And remember, ectomy, excise, I'm removing. Hyper and hypopituitarism, right? Hyper, too much pituitary. Hypo, too little, okay? Thymus, your thymus gland, and remember I mentioned you'll be looking at that a little bit more closely in your anatomy and physiology regarding your immune system and T cells. Thyroid, thyromegaly. Now, megaly, we already know that it is an abnormal enlargement. So if you have a thyromegaly, you're going to have a little lump or bump in your neck, and we're going to want to see if that's cancer. Or it could just mean you could have thyroiditis. It could mean a whole bunch of other things, infection, inflammation, and that's your thyroid gland. And if it worse comes to worse, we can do just like the parathyroid. I can perform a thyroidectomy and remove it. Now, some of you may have heard this term before, toxicology, right? Logi, study of toxins. Now, to include your typical toxicology screen has other poisons in it, such as anything that's narcotic-based, or it can also test for THC, which is the active ingredient of marijuana, tetrahydrocannabinol. But think of the more common illicit drugs that are also part and parcel of a toxicology report. And laboratory medicine will do that. And also pathology, logi, study of disease, they will also look at toxicology reports when they're looking at cause of death. Okay, because you never know, someone could have been poisoned, or they could have had some metabolic issue that led to poisoning, and things of that nature. Because the Department of Pathology, logi, study of patho, disease, they're the ones who get to the real reason, or your COD, or the cause of death. Dipsia, that means thirst. Now, poly means too much or many. So polydipsia, too much thirst. Now, this is the classic P's or 3 P's of diabetes mellitus. You have polydipsia, okay? You have polyphagia, and you have polyuria. So let's look at all 3 of these words. Poly is the prefix that means too many. So ia, state or condition of too much. Dips is drinking, as in water, not alcoholism. Polyphagia, state or condition of too much, and phage is eating. And polyuria, state or condition of too much urinating. Okay. So this makes total sense for a typical diabetic, because the problem with the diabetic is that the glucose or sugar is not going inside the cell where it belongs. And if it's not going inside the cell where it belongs, your gas tank will always read empty. So what will you be doing all day? You're going to be eating all day, right? And who eats without drinking? And of course, you're going to be drinking all day. Water, because you're going to be hungry all day and drinking. And then what happens if I drink too much? I'll also urinate too much. So you could see here where you can sit and try to memorize things, but if you look at the pathophysiology, right, the way the disease works or doesn't work in your body, you could pretty much figure stuff out, and you don't have to memorize things. Or like the way I do it, you memorize it like in a story, so it can you can remember it better. Now, trophy. Trophy, it means process of growth, and hyper, too much growth. So you might see a report, of hypertrophy of cells. You could also have hypotrophy. Okay? Either way, not good. This means my cells or the tissue are shrinking. Hypertrophy, they're growing too much. Okay? Alrighty, let's look at psychology. Oh, here's some an example of a typical chart that you'll see regarding the anterior versus posterior pituitary gland. But right now, let's look at these abbreviations and how you can kind of decipher what the hormone is and what does it do. So of course, GH is growth hormone, and that makes sense. It's for muscles and bones. The ACTH, Adrenocorticotropic hormone. Oh boy, that's a mouthful. So we now know what a hormone is. So adreno, that means it's from the adrenal gland. From what part of the adrenal gland? The cortex. And what does it do? Ich, pertaining to troph, deals with growth. So it's a signal of growth of the part of the adrenal gland, which is the cortex. So if you break it down, not as bad. And TSH, we're going to go down here in counterclockwise. A thyroid stimulating hormone, that's easy. It's of course going to stimulate the thyroid. Follicle stimulating hormone and luteinizing hormone. Just know that the follicle is the pre-egg or pre-ovum, And the corpus luteum is what happens to the egg after the egg gets released in the ovaries. So you have these two um, hormones, FSH and LH, or follicle stimulating hormone and luteinizing hormone, which signal ovulation and also signal production of course, ovulation, making the egg and ovaries, and it signals the production of sperm in testes. That makes sense. Prolactin, pro means um, in favor of or promotion of, and lactate or lactin, that's milk. So it makes sense. It's for mammary glands. Oxytocin, for you ladies who had who had their pregnancy induced, maybe you had something called a pit drip. PIT is short for Pitocin, which is an artificial version of oxytocin. But oxytocin is a hormone that tells these two glands, well, tells the mammary glands here to start squeezing so that the mammary glands can now eject milk. And it tells also the uterus, which is a muscle, right? Or, mommy's womb, and baby will be inside there. And the oxytocin will make this contract so that baby can descend and move forward down the vaginal canal, which is this thing right here. You have your fallopian tubes here and your ovaries here, and all of it gets is all in its proper place in the female pelvic area by this thing called a broad ligament right here. So oxytocin, right? And ladies, those of you who had Pitocin, I'm sure you remember its effects on the uterus very, very well, because the second that thing, well, actually 1 or 2 seconds after that drug or that hormone kicks in, what happens? This uterus will start squeezing like no one's business because baby has to descend. Okay, so posterior ADH, antidiuretic hormone. Let's take apart that word as well. ADH, antidiuretic hormone. So it is a chemical messenger of anti means no, and diuresis means urination. So no urination. So it makes sense. When does ADH get released? It gets released when your body wants to keep the water. It tells your kidneys, hey, don't urinate. What's the classic example? I'm walking in a desert. I ran out of water. You shouldn't be peeing all day. Your kidneys will get the signal that you're running out of water. So it will tell your kidneys, it will release ADH and tell your kidneys, do not urinate. And what's a diuretic? Also known as a water pill, ick pertaining to urination. So the diuretic will make you urinate. Okay? But an antidiuretic hormone, no urination. I had to mention that because on my A&P exams, everyone gets that backwards because they forgot their basic medical terminology and they're trying to memorize. And what happens when you memorize? In moments of stress, you start making things, you turn things backwards or upside down. Gigantism and dwarfism. Now, again, either situation being super, super huge due to some probably pituitary defect or pituitary cancer. These patients have a lot of heart disease, a lot of joint problems, and they live a life of a lot of pain. Even though they're very, very large, they don't move very well, and they have a lot of arthritides or joint problems. And then it's the same thing as well for dwarfism as well. And of course, where do we all want to be? Somewhere in between. And typically growth hormone, which is part of your pituitary gland, is the signal of that. And you can see if the signal is too much or if the signal's too little, it causes pathologies or some issues. We went through these: stimulating growth hormone, luteinizing prolactin, thyroid stimulating hormone, ADH. Here's an example of Cushing syndrome. And you know what? I don't want to talk about that because that's for your pathology class and for your anatomy and physiology stuff. Now, what's acromegaly? Acromegaly is when features of the hands and the feet and the face get enlarged. And again, this is also related to pituitary tumors. And you could see on the drawing of this man's face, especially his jawline and his ears, and a lot of his facial features are exaggerated. Hence the term megaly. Remember, megaly is abnormal. You also have Graves' disease, also known as thyroiditis. The thyroid you can see here is inflamed, also known as goiter. My patient also has exophthalmos. Let's look at that term. Exophthalmos. US means structure of, X means out of, opth means eye. So because of those thyroid hormones are all messed up, this is a typical sign of Graves' disease, also known as toxic thyroiditis, and you may or may not have a goiter. And this person will lose a lot of weight. They'll talk very fast. They'll have trouble sleeping. It's going to look and act like amphetamines or cocaine abuse, but there's going to be other signs and symptoms. And the toxicology report will come back abnormal thyroid hormones, and it will be negative for any cocaine derivative or amphetamine derivative toxins or poisons. Let's see, glucocorticoids, right? Of course, also known as cortisol, right? And they're from they're sugars, gluco, right? Cortex, so it's also from the adrenal cortex, and that is cortisol. And you'll learn in anatomy and physiology, it has an anti-inflammatory function in your body, and it gets released during stress. So think about it. You're stressed out. Some of you may have midterms this week or next week. So you're stressed out. So what happens? Glucocorticoids, also known as cortisol, get released. So what's going to happen to your immune system? Your immune system will drop. So cortisol and mineralocorticoids and glucocorticoids, these are nice medications to lower chronic inflammation, especially for like arthritis, for the different kinds of more severe arthritis. But what else would it do? It will also immunocompromise your patient, which is not fun. Epinephrine, also known as adrenaline. And if you look at that, adrenal, that means it's got to be from the adrenal gland. And that too, epinephrine is released from your adrenal gland in response to stress as well. Because when you're scared, you got to have epinephrine because you have to have the fight or flight response, and that requires tons of energy, and epinephrine can help you get that. Now, remember I told you the pancreas was really important, and we already talked about insulin. Now, insulin puts glucose into cells. Okay, so let's talk about this because this is a really nice thing. So both of them get released from the pancreas, right? You have insulin, of course, that's one of the hormones that gets released from the pancreas, and glucagon. That's another hormone. that gets released from the pancreas. There are other hormones, but these are two of the main ones. Now, insulin, this gets released after a meal, right? So that glucose can enter the cell and be utilized for fuel. Wait, I don't know how to spell fuel. Now, glucagon is the exact opposite. Let's say you haven't eaten in a while. So, gets released when you are hungry. And that tells fat cells to release sugar or glucose. So, insulin, after you eat a meal, then the glucose can enter the cell and be utilized for fuel. Glucagon gets released, you haven't eaten for a couple of hours, not a couple of hours, like 5, 6, 7 hours, you're at work. So you have to break down some of the fat cells. And that's what fat cells actually are. Fat cells are storage form of glucose. And if I break them down, glycolysis, or, whoops, I spelled it wrong. Remember that word? Lysis? So that's breakdown of sugar. That's why also what has a lot of fat? Liver. So what has a lot of sugar? So glycolysis occurs primarily in your liver. It breaks when you're a little bit hungry. The hormone glucagon from your pancreas tells your fat cells, hey, break down, release some sugar. I'm a little bit hungry. Okay. Now you could see, especially insulin, where diabetes can mess things up. Because if insulin doesn't work, can glucose go inside the cell? And if glucose can't go inside the cell, it's going to float around and cause a ton of damage. And the analogy that I always use is, when you're at the gas station pumping gas, where should the gasoline go? It should go inside the car or inside the gas tank. Should gasoline be on the hood of your car or on your seats? No, and that becomes a dangerous thing. So glucose is not a bad or good thing. It just needs to be in a certain place in a certain amount, right? And if it's not, it causes diabetes, and diabetes is one of those diseases that's all of the above. It'll affect everything. All right, nervous system. This is a picture of a neuron or a nerve cell, and you're going to go through this in greater detail in your anatomy and physiology class. And the function of this nerve cell is to take electrical impulses. Yes, you have electricity in your body, and then it converts it to chemical, and then back to electrical. And the chemical that goes in between the nerve cells is called a neurotransmitter. Maybe you've heard of some of them: GABA, norepinephrine, dopamine. Those are your classic neurotransmitters, and they're related to certain signals in your body. Because remember, your nervous system deals with signaling, and signaling through that nerve cell known as the neuron, and it does it pretty fast. So let's look at some of these neurology terms. So a neurologist is an expert of not only the nerves, but the brain and the spinal cord as well. So cephalo means head. So if I have hydrocephalus, I have water or too much water in my head. And remember, water is a good thing, but too much of it, very, very bad. Cerebrum, structure of your, the best way to put it, your cerebrum. If they, let's show you a picture. Because yeah, you could say the word brain, but we're talking more about this part of your brain, the top part, and that's the cerebrum. And then there's your brainstem and there's other things. But the top part here with all the lumps and bumps, that is your cerebrum, okay? So if I have CSF or cerebrospinal fluid, that is not only in fluid that's in my spinal cord, but it's also surrounding my cerebrum or that part of my brain. And that's why we do a lumbar tap. Let's look. CSF. See, if you look at the brain, there's fluid all around your cerebrum, and it surrounds your entire brain, and then it goes down your spinal column. So if it goes down your spinal column, we could tap this, right? And we can now know what's going on in your brain because it's the same fluid. You could also see how delicate this all is. If I get an infection in my spinal cord, or maybe a needle or this gets punctured, or something bad happens, maybe trauma from an auto accident or something, you could see blood or bacteria or a virus. If something gets in this, what will it also affect? It will also affect my cerebrum up here. So that is called cerebrospinal fluid, also known as CSF. Encephalo, inflammation or infection of the brain, and that's just a generalized term. So if your patient has encephalitis, highly contagious, please don't hang out in that room unless you need to be. Glioma. Now, what's a glial cell? A glial cell, we showed you this thing right here. This thing is the neuron. This is the star of the show. And the star of the show only performs the function, which is to propagate or to move the signal. That's all it does. But there are other support cells that are required. You're going to need other cells to clean up after the star, right? You're going to need a makeup crew. You're going to need a lighting crew. You're going to need a lot of support. Someone has to also feed the star of the show. And those are glial cells. And a glial cell is a support cell. So a neuroglial tissue, they're support tissue. They're the glue. They're the thing that holds everything together. But you could have a glioma. You have a gliocarcinoma. You can have an inflammation, infection, or cancer, or a cause of a tumor within that support cell. And if the support cells go down, what's going to happen to the neuron or the nerve cell? The nerve cell will also go down as well. So we have coverings, and they're called meninges. And again, you have meningitis. Please don't hang around unless you need to be. Highly infectious patient, and that patient is in a lot of danger because the covering of their brain is now infected. Same thing with the meningioma. If there's a tumor in your brain, that's of considerable concern because your brain and spinal cord are sterile. So cutting into it would not be a bright idea because the outside world is very, very full of bacteria, viruses, and whatnot. And your brain is pristine. It is very, very clean. Your spinal cord is very, very clean. So introducing bad things into it through surgery is of concern. That's why survival rates for a lot of neurosurgery isn't so hot, and you can look it up. Myalgia, now, or a myeloma or myelitis. Algia means pain. Myel means bone or spinal cord, depending on its contents. If we're talking about bone, it's the bone marrow. But if we're talking about this in neurology, we're talking about the spinal cord. And of course, neuron is the nerve cell, and I could have neurolysis, right? Destruction of a nerve. There's certain medications that do that. Paresis means paralysis. Now, let's look at the word paralysis because that's a tricky word. Now, we all know what, when you're paralyzed, what it means, but what does it mean via medical terminology? We already know lysis means breakdown, and para means along the side. So what does it mean, breakdown along the side mean? So paralysis. Well, let me show you how your spinal cord and spinal nerves work. Well, at least basically. If you look at this, Of course, this is your spinal cord. And all that's coming out of here, those are your spinal nerves. Now, remember, these things have the signal. So your motor signal, or for you to move around, or to motor around, has to originate in your brain and then goes down. But what happens if I get into an auto accident and I have a cervical 3 or cervical 4 fracture, and then it cuts my spinal cord? So that means the signal will go all the way down here and stop. Everything from here on down won't work, okay? And once you sever a nerve, it stays cut. So that means all these spinal nerves along the spinal cord that are alongside it will now break down and they will not work. And if you'll notice how the numbering system, C for cervical, Al pertaining to your neck, T for thoracic, Ich pertaining to your thorax or chest, L, lumbar, that's AR pertaining to your lumbar or loin, and then S for sacral pertaining to your 5 or 6 fused bones here called your sacral bones. So if my patient has a C5 fracture, then now you know it's where? Cervical, in their neck. If they have a T6 fracture, that means it's what? Thoracic 6. It's part of, they're going to have some chest problems because that's your thoracic nerves here. You have 12 ribs, therefore you have 12 nerves, T1 through T12. And your lumbar, your lower back, L1 through L5. So if you have a lumbar tap to get into your cerebral spinal fluid, right, or the cerebral spinal canal, what do? Between L3 and L4, and I put it right in there. Hopefully I don't puncture any of these things because that would be bad news. And of course, sacral, those are your fused bones leading to this big nerve here, your sciatic nerve. If you're talk to somebody who had sciatica, they had a pain where? From all the way from their tailbone all the way down to their heel. Okay, so now you know what paralysis means. Lysis alongside, or breakdown of alongside your spinal cord. So if you have hemiparesis, you'll be paralyzed from one half of your body, either the left half or the right half, okay? If you have quadriplegia, you have paralysis of all 4 of your extremities. If you're paraplegic, you'll have paralysis all the way from your cervical all the way down. And aphasia, now not to be confused with phagia. Phagia with a G, that means to eat, but phasia with an S, that means to speak. And aphasia means no speech. Now, that doesn't necessarily mean that you can't talk, but there's different types of aphasia. There's ones where there's patients, they pick up a pen, they can write down the word pen, but they can't tell you what's in their hand. There's other aphasia where, the person knows what to say, knows what you're saying, but can't express themselves. So there's, like I said, different forms of aphasia, state or condition of no speech, okay? And of course, you can have a complete aphasia, the inability to speak. Again, your brain, spinal cord, cervical, thoracic, lumbar, sacral. Here is your epidural, right? Or a lumbar tap. You can see where we put it. We put it in the lumbar area or the loin area or the waist area. Anorexia, we talked about this before. And we talked about the majority of these. Nice to know, nice to review. And I also talked about the numbering system, how we number the nerves in your spinal cord. Here's some diseases. Of course, diabetes, must know. But the others, you'll get it through your pathology. Again, you could see here what we were talking about. If you have a C4 injury, you'll be quadriplegic on the head on down. C6 will be here. It'll be from your shoulders on down. Right? And those are all different types of paraplegias. Sciatica, we mentioned that. Let's talk about seizures. Now, not all seizures are epilepsy, okay? And these are two major types, tonic-clonic, which is the typical seizure, and absence, also known as petit mal, because the French were really, really good at neurology in its infancy. So absence is, if I had a friend of mine who had absence seizures. He used to daze out in class, and you couldn't, he wouldn't move for minutes, and he would just stare at the board or stare at whatever, and then he'd wake up and he wouldn't remember where he was. Same thing with tonic-clonic. That's the one where you see it has a lot of excessive movements and muscle tone. Now, the big thing on tonic-clonic seizure is just make sure the patient is safe and doesn't hit anything, especially their head, okay? Please do not stick anything in their mouth, okay? You have to have a patent, nice open and patent airway. I wonder if we talked about CVA versus TIA. And if I haven't, then I should do it now. So we talked about AMI, which is an acute myocardial infarction. And that's also known as a heart attack. Well, let's talk about CVAs, which are brain attacks. Cerebral, vascular, accident, right? And this is a stroke. Okay? Now, CVA, cerebral, that means your brain. Your vasculature, which is your arteries and veins in your brain. And just like the heart attack, maybe a piece of blood clot or something else got lodged, and then you'll get a stroke. Now, what's a TIA? It's a transient ischemic attack, also known as a baby stroke. Baby strokes or TIAs, they have similar but more milder symptoms than a stroke. And if you don't know your symptoms and don't know your warning signs for stroke, look this up, FAST. Okay, right? So transient ischemic attack, or TIA, right? It's like a baby stroke. Transient means what? It's just going to come and go. The symptoms will come and go really quick. Now, ischemia, let's look at that word, because ischemia is also important in myocardial infarctions or heart attack. Emia, we already know, is blood condition, and isch means blockage. So blood condition of blockage, and that's ischemia. Now, it could be fat, it could be a whole bunch of cholesterol, it could also be a bunch of platelets, like in a clot, and it could also, well, there's a whole bunch of things. Just know that if your blood gets blocked, everything downrange will have no oxygen. And that's bad news, because just like glucose, your body needs oxygen. And if it doesn't have it, it dies. So in a heart attack, there's going to be a piece of your heart that died due to this blockage or infarction or ischemia. In CVA, same thing. And TIA, if your patient was diagnosed with it, within 5 years, they're going to have a CVA. So it's a nice little, warning, a TIA. So that's what a TIA is, CVA, and of course review for an AMI. FBG or FBS is fasting blood glucose or fasting blood sugar. It should be done in the morning because your patient should not be eating anything per mouth except water and lots of water, but nothing else. Even a sip of orange juice is going to ruin that test. GTT or OGTT or oral glucose tolerance test. This is the definitive test for diabetes. Some of you ladies may have had it when they were testing for diabetes or gestational diabetes, maybe when you were pregnant. Not maybe, they definitely should have done it. If they didn't, you might have a lawsuit in your hands. Here's that lumbar puncture that we talked about, the needle in the lumbar area between L3 and L4. MEG, MRI, PET, nice to know. MRIs are magnetic resonance imaging. PET scans are positron emission tomography. Let's look at the word tomography. Graphy is the process of recording, and tomo means location. So a CT or computerized tomography or like a PET scan, they use like radioactivity, like X-rays, and in the case of PET, positrons, which they're all radioactive. But again, it's mildly dangerous to your patient, but we really shouldn't do these things like every day. But just like a CT and a PET or a PET scan, we're using radiation like X-rays to try to see what's going on inside my patient's head. These things, nice to know. Hypoglycemic, we already went through that. So an oral hypoglycemic is going to decrease your sugar. Oh, let's look at this word, anesthesia, which is they're not neurology, but they are their own department for obvious reasons. Now, anesthesia, state or condition, and of no aesthesia is feeling. Because when you have anesthesia, you don't want to feel or even remember anything that went on. So an anesthesiologist, their function is to make sure that in surgery that you don't feel anything, and that also you have amnesia. State or condition of no memory. You don't want to remember someone cutting into your belly. I don't. So anesthesia and amnesia. Another thing that the Department of Anesthesia, also known as the Department of Pain Management, they're really good at pain meds for chronic pain. Chronic means pertaining to. So long-term things. And remember, the exact opposite of long-term is acute. So something acute, like an AMI, acute myocardial infarction, happened, boom, right now. But chronic, it's over the course of time. And if you have some pain management states or some pain problems, and you're having difficult with opioids and things of that matter, the Department of Anesthesia, or also known as the Department of Pain Management, will help you deal with that. So they're not only gas passers. Those lovely people in surgery who are not doing the surgery, they pretty much monitor your life, all your vitals and everything. Anticonvulsants, of course, against convulsants or against seizures. Antipsychotic, anti-Parkinsonian. Anti means against Parkinson's disease, of course. Now, let's look at the word psychosis. Osis is abnormal condition, and psych is mind. right? That's why who deals with these people? Psychiatry, right? And psychiatry, they are MDs, okay? Because they give medications for things like psychosis. There's also other things, neurosis. Heard of someone? Abnormal condition of nerves. You know, if you're nervous. Now, all of us have a little psychosis. All of us have a little neurosis. But what makes us normal is we bounce back. A classic example, ever get mad at your kids, right? Get so angry that your head might explode, but then you come back to normal. How about neurosis? Every once in a while, I wake up in the middle of the night wondering how I'm going to pay my bills. I don't know why. I just get nervous about it, especially around tax time, right? But then you calm yourself down, you go back to sleep. But someone who's truly neurotic, they might need medications to deal with those nerves, okay? And of course, psychiatry is very, very different than neurology. Now, let's look at our case for today. And I'm just going to give you some hints because this week's discussion for week 5 or module 5, whatever they call it, you will be creating your own exam or mini quiz based on either this one or this one. There are typically 2 or 3 cases per chapter. But this one, read over this one on diabetes mellitus, and then look at the common words and some of these questions here, right? And do the same thing for this peripheral neuropathy patient here. And I would like for you for next week, and I'll write down the instructions. Heck, let's write them down right now. What are we going to do for this week? So, of course, week 5. And then we can go to discussion forum. Either you can answer my discussion or you can create your own. So first of all, read both cases. At the end of the neurology endocrinology chapter, choose one of the cases to create a 5-item multiple choice quiz. And then you post your Microsoft Word document with 5 multiple choice questions pertaining directly to the case of your choice. Okay? Now, of course, it's due next Monday, but again, like I said, please try to get your initial responses out, before Saturday because grades are due. But it shouldn't take you long. You read the case and you already know SOAP, and you can create a 5-item quiz, and make sure to put your name both on the file and the document itself. Let me post this thing up. And right now, let me give you an example on how I could do that. So, whoopsies. Let's go to the case. So let me pick any part of the case here. So I can have something like this. And of course, it's the impression. And this is how I'm going to make a question. So I'm going to, of course, okay. Now, of course, this is not the quiz, but I'm gonna start looking at, okay, what's some good words? This is a good word. Lupus does not have major clinical physics. Says central nervous system, right? And autosclerosis, right? And so you see, I first identified what? What are some juicy words? Now I could make a question out of it. So, which of the following was a diagnosis of our patient? Was it, oopsies, was it cerebral? Was it a stroke? Baby stroke? Nerve disease? Heart attack? E, answers A and B. Right? So when we're looking at this, right, and I've identified those who are, remember, impression is the diagnosis, right? So now I'm looking at the impressions. So did my patient have a stroke? Nope. And that's a CVA. Did my patient have a baby stroke or TIA? Nope, doesn't look it. Does my patient have nerve disease? Peripheral neuropathy, pathy is what? Process of a disease. Neuro is nerve, right? So that's a consideration. Did my patient have a heart attack? Nope. So the best answer is nerve disease. And that's how you would, I can even make another one. Which of the following was a diagnosis of our patient? Right? Amnesia, hardening of the ears, softening of the ears, missing ears. So again, let's look through that again. Which of the following was a diagnosis of our patient? Well, we have central nervous system and peripheral neuropathies and arthralgia. I don't know, because that's not a choice. Autosclerosis with hearing loss. Now, auto means ear. Sclerosis, abnormal condition of hardening, hardening of the ear. So you have what? Hardening of the ear. That's just with the impressions. So now you could see how easily I could take all of your cases from chapter 2 on down. I could take all of the cases and then I could easily make exams out of them, or you can easily make exams out of them. And knowing how to make the exam, now you already preempted your teacher. You already know. And of course, please don't use this example, but do something similar. So that's your discussion for this week. That's what you should be able to do. And only 5, and only from one case. So pick a case, either this one, which was the neurology case, which is peripheral neuropathy, or you could pick this case, is the one above it, and that's the discharge summary of a patient who had diabetes mellitus. And this can help you. These are the, right underneath are the significant terms and some sample questions that you can easily convert to multiple choice. All right, that concludes the lecture portion of the show. And please finish your week 4 items by closing a business today. and so we can start wrapping up grades and try to get um, a couple of items out for week 5 so that your grade can be a little bit more complete, so that you have a more accurate of midterm grade. And again, public service announcement. Registration is starts this week. I will be posting up times of, if I am your advisor, times where you can log in. But another thing you could also do is just email me, and I'll get you best schedule, and also with instructions on how to do it if you've never registered online before. And if it doesn't work for you, call me back again, and then I could register you manually. So 2 things: get stuff done this week, and of course, registration starts this week. So if you don't know how to do it or what classes you need or want for next term, please get an email out to me today so that I can get something for you so we can get you registered for the week. All right, with that being said, if there are no questions, anyone have any questions?
Nope, thank you very much.
If
Yes,
not,
I have a question.
shoot.
Okay, so for the quiz that we're creating for this week's discussion, are
Yeah.
we also putting the answers along with the questions? Like, are we highlighting which one is correct?
Yes, highlight or right underneath it, answer is. Okay.
Okay.
Alrighty?
Yeah.
Anybody else? Okay, if not, thank you very much, ladies and gentlemen, and I will see you next week. And please, please, please get stuff done. All right? All right, have a good one.
Thank you.